Everybody, thank you for joining us. We're excited to be here today to pause a bit in our deliberations in Albany as we're working through the budget and everything that's going on there. To be able to come here to Western New York and sort of bring this good news in an important subject and an important sector that we're all talking about a lot lately. We know that the federal government has taken a brutal, inhumane position around Medicaid funding, around healthcare in general. And we know that it's the responsibility of everyone to make sure that we counter that as much as we can. So at the state, we're having all kinds of conversations as the budget is going on around what we're doing to make sure that people stay covered and to make sure that hospitals are kept whole, to make sure that workers that work in the healthcare industry continue to get the support that they need. But sometimes it's simple. Sometimes we need to take spaces and make them into spaces where in which services can be provided. And this is a community that always can use more primary care, but it's a rarity that we're able to make that happen. Today we're announcing a grant from New York State to be able to fund Neighborhood Health Center, an incredible organization that's been doing all kinds of great work across the region, to come into this space, a space that at one time provided services but was closed, to sort of reinvigorate it, bring it together, provide services, and make it so that people that live in this community can have access to primary care. Those are the kind of things we're doing in New York State. We're stepping in where the federal government has absolutely decided to approach the needs of people, the health of people, the future of people with cold indifference. So I'm announcing $200,000 in state funding that I had the good fortune of being able to allocate along with the leadership of our majority leader, who you'll hear from in a moment, but also certainly the Speaker of the State Assembly, Carl Hastie, who's always been in the forefront and very present in the needs of Western New York. This investment will improve facilities, not just here in this space, but also at their location at 1569 Niagara. And as we know, this is an important neighborhood, a thriving neighborhood, but certainly a neighborhood in need of more services. We know that we're at a turning point in our region where we have to constantly fight for the resources to get us what we need to do, and that's why I have the good honor of not just serving in the State Assembly, we're able to do all these good things, but specifically serving in this moment, in this time, with Majority Leader Crystal Peoples-Stokes, who's not only a tremendous leader in Western New York, not just a tremendous leader on countless issues, but I can tell you she represents Buffalo like no one else has in Albany, not just carrying the flag for the region, but really fighting for working class people. And that's what we're called to do. So without further ado, I'm going to turn it over to Majority Leader Crystal Peoples-Stokes.
Thank you, Jonathan. Thank you. And I guess it's still morning. I've been up for a while. So good morning, everybody. How's everybody doing? This is a great opportunity. I remember when there was a grand opening here because it became an urgent care center. And it actually did get a huge patient base, so I'm not really sure why they closed, but I do believe that it's better to have a primary care physician than to go somewhere on an urgent basis. And so I am really overwhelmed with gratitude for the Neighborhood Health Center to expand its reach into this side of the great city of Buffalo. So I want to thank Joan, of course, because her leadership is critical here. Thank you very much for what you're doing. And I certainly want to thank my colleague, Assemblymember Rivera. As he mentioned, we have a challenge at state level of government. We have a lot of people in our state who rely on Medicaid. And we have a president who doesn't want people to rely on Medicaid. And I'm not sure why. I guess it's because he's so wealthy and steadily earning more money as he's the president. But that's not fair, and that's not right. And so what we have to do as New York representatives is figure out a way, when he takes from our people, how we can restore that. I think this is one of the ways that we do that, because the more people have access to primary care, the less they're going to have a need to go into the emergency room at ECMC or Kaleida or Sisters or those other places where emergency rooms are just overflooded with people who don't have access to primary care. And you're sitting next to someone who's horribly ill and you really just have a cold that's treating you very bad. You should be trying to talk to your primary care doctor. So I know by the research that's been done that there's 22% of the people who live in this specific community who are Medicaid eligible and probably now receiving those services. That we can't count on in 27. not at least from the federal government. And so we have to make ways for people to have access to healthcare. So I'm grateful to be here with Jonathan. I really like this idea of this project. And so Jonathan mentioned that he had a check for $200,000. I want to add to that. And again, thank you, Speaker Hasty, for my capacity to be able to do that. Another $200,000. I am hopeful that, Madam Joan, when you're ready to open, that there's not a person in this neighborhood that doesn't know this is available to them. It's going to call for huge outreach. Just because you build it doesn't mean they're going to come. You're going to have to go out there and get them to come. I won't say you don't know what their addresses are, you won't know that, but you do know that they all live around in this neighborhood. So if you just do door knocking and passing out literature, like don't go to emergency room for health care. Come here and get a primary care doctor that you could see on a regular basis, and they can help you maintain your life into a healthy style. So again, thank you so much for what you guys are doing. Congratulations. I wish you all the best. And I look forward to the day when the place is flooded with people who need to have access to the service that you and your team will provide. So thank you very much, and God bless.
Thank you, Majority Leader People Stokes and Assembly Member Rivera. I'm Joanne Hafner. I am the President and CEO of Neighborhood Health Center, and this recognition of the work we do, we couldn't be more proud to be honored with this contribution to the work. We're standing here today at a site that's going to open this summer is Neighborhood Health Center Delaware. We are here because we did a search of where our patients are coming from and see that around this neighborhood there are a lot of patients who still do need care. We also really want to tell you how we got here. As our Assembly member said, access to care is not easy here. And around 2019, Neighborhood Health Centers started to run out of capacity for care at our oldest site, our 37-year-old original site, Neighborhood Health Center Northwest on Lawn Avenue in the community center. And from that, we did a search of places where we could provide additional care and fix the capacity issue at two of our Buffalo sites. We ended up purchasing a warehouse and converting it into Neighborhood Health Center Riverway that's on Niagara and Forest, and that opened in June of 2022. Today, it's at full capacity as well. So the need to access primary care is critical, and that's what has gotten us here today. When we open the doors here, we'll have 13 exam rooms. We'll be able to care for primary care, family medicine patients, about 18,000 visits for their family medicine, as well as getting them access to behavioral health and counseling. But it also opens the door for all the federally qualified health center services at all our other sites, such as prescription delivery, OBGYN services, podiatry, and much, much more. So that's one of the reasons we see this as an opportunity for us to really open primary care for our community. On a personal note, I'm a lifelong Buffalonian and Western New Yorker. I spent my childhood as an uninsured, most of my childhood. And my mama made some significant, tough decisions when we were kids. And I can tell you for sure, I have zero memory of a primary care visit. I have a clear memory of sitting on a row of mismatched folding chairs at a fire hall, waiting to get my childhood vaccines, so I would be able to attend school. I grew up and said, I think we can do, as a little kid, I knew we could do better. As a little kid in my gut, I knew that healthcare was a right, just like all of you do. And today I went from medical assistant to a registered nurse, nurse practitioner, and today I get the honor to be the CEO here at Neighborhood Health Center, where we have created a welcoming place for all people, so people will get preventative and primary care. We know that that trust that we build will stop people from going to the emergency room. And our elected officials are insightful in trusting us. Our experience is high quality, not just access, but we are the highest quality health center in this region. So we know that if you come here as a patient, the likelihood your health outcomes are better is higher just because you've come here. So this investment is a critical need for our community. It does show the insight of the impact of the federal changes because we know it's not going to get easier for anyone to get a primary care visit, especially in our community. It's really looking forward to expanding here where we know so many more people need care, and having the opportunity to bring that to more people in our community and help to give people hope when sometimes this year there hasn't been a lot. So thank you for helping to provide that. Thank you all for coming today. Back to you.
We'll open it up to any questions.
How soon do you think it'll be in operation? I'm sorry. We plan to be open early summer. We're in the permitting phase right now in the city, and we know that the new mayor has been very favorable about new businesses getting moving, so we're ambitiously looking for early summer.
What's the biggest challenge of like transforming what you have here in the guts of this building?
Well, we are regulated by the Department of Health in New York State, so there's very detailed policies, procedures, office exam room size, and that neighborhood has prided ourselves in being welcoming and not having mismatched folding chairs in our waiting room, that we have a sense of love for the people who come here, so this investment's going to make that possible for people to feel able to walk to a doctor's office that is beautiful on the inside and provides respect. Thank you for that question.
Any other questions? All right, well, let's take some nice pictures.
Thank you so much for coming.
I know you guys came. It's for the big check, everybody knows.
So,
Big check.
let's give it a
He's got the incorrect
Yeah.
amount, so majority leader on
So-
correcting that.
Put a line right through that 200.
What a happy Friday.
Thank you, everybody.
Thank you.
Beautiful.